Okay, it looks to me like the numbers have started to level out, so I'll begin. So welcome everyone to this Epidemic Ethics webinar. Delighted that so many people are here with us today. This is a first in a new series of webinars from Epidemic Ethics, which is going to be looking at different regions of the world and spotlighting some of the complex and unique ethical challenges affecting those regions, but also how those regions might learn from each other. So particularly focusing on the experiences of the COVID-19 pandemic itself, but also thinking about the implications of this for preparedness, prevention, response, and recovery from pandemic. So what can we learn from this in particular regions, but also what can we learn between particular regions? My name's Mike Parker. I'm a professor of bioethics at the University of Oxford and one of the organizers or applicants on the Epidemic Ethics project. And I'm going to be chairing today. In a moment, I'll introduce our speakers, but a couple of things first. First of all, I wanted to remind you that this webinar is being recorded. And I'll say something more about that in a minute. If you just want to say hello to people on the webinar, please do use the chat function for that. But if you want to ask questions to any of the speakers, so I will be trying to keep an eye on the questions and using those in my questioning after the speakers. Please use the Q&A function for that. So don't put questions in the chat. Please put them in the Q&A. That's going to help me with my job of chairing. And also, if you like a question, please could you use the like function, and that will help us prioritize the questions, and the ones that have most likes on them, then I'll try to focus on asking those. Later, so as I said, the webinar is being recorded. The recording is going to be available later on the Epidemic Ethics website, so later sometime in the week, and it's also being live streamed on TGHN's Facebook page, and the recording is going to be available there too. As I say, my name's Mike Parker. Delighted to be here today, and we've got three great speakers who are all going to speak for a few minutes, and then we'll open up for discussion. The first of our speakers, I'll introduce all speakers now, and then I'll just introduce them briefly as they go through. Our first speaker is Professor Signe Mežinska, who holds an MA in philosophy and an MSc in bioethics, and is a Doctor of Science in the sociology of health and illness. She currently lectures as a docent at the University of Latvia in the Faculty of Medicine, and is serving as Vice Chair for the Riga East Hospital Foundation Research Ethics Committee. She's also a faculty member of the Advanced Certificate Program E-Education and Research Ethics, Central and Eastern, and is a board member of the non-governmental organization Health Projects for Latvia. Our second speaker is Professor Siobhán O'Sullivan. She's been Executive Director of the Royal Irish Academy since 2022. She's also a professor at the Royal College of Surgeons, Ireland, where she teaches healthcare ethics and law, and is involved in curriculum development. From 2011 to 2022, she was the Chief Bioethics Officer at the Department of Health in Ireland and Director of the Irish Council for Bioethics from 2002 to 2010. She's the Vice Chair of the European Group on Ethics and Science and Technologies, and a former member of the Advisory Council for Science, Technology and Innovation. She received her doctorate in medicine from the Karolinska Institute in Stockholm, and holds a master's in healthcare ethics and law and master's in human rights law. And our third speaker is Professor Maria do Céu Patrão Neves. She's professor of ethics. She's president of the National Ethics Council for Life Sciences, vice president of the European Group on Ethics for Science and New Technologies of the European Commission, and a member of the Lisbon Academy of Sciences. And from 2009 to 2014, she was a member of the European Parliament. So I'm delighted to have such eminent speakers with us, and very much looking forward to the discussion about the implications of COVID-19 for Europe and how we might think about this in the future. So our first speaker is going to be Professor Signe Mežinska. So over to you, Signe.
Thank you very much for these introductions, and I hope you see my slides. I have a couple of slides here.
Yeah, we can see those now.
Fantastic. Thank you. And it's my honor to represent here a small country in Europe, and I think that I'm representing Latvia, and I think that on the one hand, our experience is in line with experience of other European countries, because I think Europe was quite organized and quite uniform in many senses in response to the pandemics. But on the other hand, being a small country, it brings up specific challenges, and maybe we will tackle them in the discussion. And I will also try to show what is unique maybe for small countries. So if we look back, I have put here 4 points which from today's point of view seem very important for me. And if I'm looking at discussions right now in the region, I see that one of the biggest issues looking back is protection of vulnerable groups. And in our case, when we have this solidarity-based, publicly funded healthcare system, it's mainly about, and we thought it's quite a strong healthcare system at that time. But now, after the pandemics, we see that there are consequences, and not only for people who suffered from COVID, but also for other vulnerable groups like oncology patients or diabetes patients who lacked access to healthcare services and who experienced disruptions in care. So another group is people who suffered in terms of mental health, and there are different groups, but right now the biggest emphasis in discussions is on children and adolescents. It seems that we didn't protect enough children and adolescents during the pandemics in their needs, because I think Latvia was one of the countries with the longest remote teaching period, and it has quite big consequences. Then the second point is test of global solidarity. And being here in Europe, I think we are in some kind of center of discussion about sharing benefits or practicing solidarity, because one of my roles currently is in International Bioethics Committee in UNESCO, and there we have quite a global audience, and we saw that countries outside Europe, especially countries outside Europe, see the COVID period as this test of global solidarity, which wasn't successful again. So then responsible research practices, and we have had many discussions about ethics review of research studies, and we have I think quite a good experience in Europe how to organize it and how to do it quickly, etc., etc. On the other hand, we can always be better prepared and prepared to do it in better quality. But one point which is maybe not so much discussed is about publication practice during COVID and interpretation of preprints and retractions. I looked in a Retraction Watch database before this conversation, and they have a list of retracted COVID publications, and currently it lists 372 publications retracted and 18 expressions of concern, and it shows that something went quite wrong with publication, very quick publication practice during the COVID. And also we have some stories about publication of preprints, which were taken up by media in very hyped manner, and the consequences weren't good. So, and decision-making process was also very important part of COVID story. And Now I move to my next slide, and I have only 2 slides. And this slide is about looking forward. And I see the main question is how to ensure evidence-based decision-making, because we witnessed that decision-making was very politically loaded at COVID time. And I have participated in several discussions about role of experts in this political process, and I have heard voices from ethicists in Europe who say that they, and not only ethicists, also medical experts, who say that their role was not as they expected during this process, that they had experienced political pressure, etc., etc. So how to balance political process with expert voices during pandemics, and of course role of public communication, role of trust in science, role of news and social media. That's all very important. Risk communication is also very, very important task for future, how to communicate risks. And we see many challenges, and hopefully there will be lessons learned. Resilience of healthcare system. And if we look back at my previous slide, it means not only preparedness for these pandemic situations, but it means also preparedness to continue care of different groups of patients during any pandemic, like I said, oncology, diabetes, any kind of patients should get their care necessary. And it's something about resilience of healthcare system in pandemics. And regarding research, I think one important point which we can take as a lesson from COVID time is this need for globally connected clinical trial networks, which is still not in place. We saw many challenges in organizing international trials. We saw challenges in ethics review. We saw challenges in involvement of patients, etc., etc. So we didn't demonstrate the best possible way how to collect data internationally and how to base decisions on these data. I think it's in a very short, these are my main points, but I'm looking forward on the questions and the discussion.
Great, thanks very much, Signe. It's really interesting, lots to talk about there. So I'll move on. First of all, we'll get our 3 presentations. So I'm going to hand over now to Professor Siobhán O'Sullivan.
Thanks very much, Mike, and good afternoon or good morning or good evening to all of those of you who've joined us. When I was reflecting on this, I was thinking to myself, so what are the 3 things that I think are important that I've learned from this whole process? And I suppose I would start, so my 3 points are that equity matters. We know that in terms of, and that was certainly true in Europe, but I think in other parts of the world as well, that we saw the highest burden of cases. We saw the highest burden in terms of mortality and morbidity, and let's say the lowest uptake in vaccines when they became available in lower socioeconomic groups or certain marginalized groups. So clearly equity matters, and that we can't simply pretend that a pandemic happens outside of a larger societal infrastructure. So there were certain sectors of society who did a lot less well than others. And I think if we're talking about the future and resilience, I think the reality of that is we have a much bigger challenge, which is to look at equity in our societies and to decide how we want to address that, because that will determine our resilience or otherwise to these kind of global events that we're going to face. So the next thing I think matters, and this is, Signe has already alluded to this, I think data matters. So having good real-time, reliable, accurate information. So being able to share that information, I think, is really important, because it has to be able to inform decision-making. Even with the best information available, you're still only making decisions. No data set will be complete. That needs to be acknowledged. It needs to be accepted. And it can't allow you to somehow become paralyzed. So decisions need to be taken, and we need to accept that our data won't always be complete, but we do need better data sources, and we need better ways of sharing that data. In the Council of Europe, so I chair the Committee on Bioethics in the Council of Europe. We were really lucky in the sense that we had 46 countries who could share expertise, who could share data, who could share inputs, and that was hugely useful. Not every country in the European region took a similar approach. There were differences. There were a lot of consistencies, but being able to access that kind of information in real time was really, really important. So that question around data utility, data sharing, we need to think about how we're going to manage that going forward. And then the last thing I'd say is the other thing that matters is values matter. So we here in Ireland, so I was a member of our public health emergency team, there to give the kind of ethical input like yourself, Mike. And the issue there for us was, as a group, as an advisory body, we coalesced around a couple of key priorities. So in Ireland, the priorities were to ensure that the hospital system didn't become overwhelmed. So there was very much a kind of ensuring people didn't escalate into emergency departments or ICUs or so on. And that required certain sacrifices from the general public in terms of mixing and so on. That was the first priority. Second priority was to try and keep children in school. We also had long periods of time where children didn't attend school, but that was certainly one of the priorities we wanted to protect. And the third was to protect vulnerable populations. So older persons, not necessarily you're vulnerable by virtue of being older, but certainly because of perhaps your set of circumstances, you might have been more vulnerable. Children, for example, who might have had special needs, we at least tried to keep the schools open for those children so that they would have supports, etc. But what I find interesting about that is that wasn't decided at the population level. So the question of what kind of values underpin your decisions, because this idea that the science dictates that is, of course, well, to my mind, slightly naive or nonsensical. All decisions that are taken are underpinned by a particular view of the world, by a particular set of values. There's really no point trying to work those out in the middle of an emergency, or trying to consult widely to ensure that the population actually agrees that those are the key core priorities. So that's the kind of discussion we need to be having now, so that we're clear on what it is we want to protect, who it is we want to protect, and what values we're going to depend on in making those kind of decisions. So I think there are many things we did well in Europe. For example, I would point to joint procurement of vaccines. That really, I think, was very successful. And then when you look at how we managed PPE, for example, where we were all competing with each other for very scarce resources, we took a completely different approach. So I think it's interesting to see how those things work and why we adopted something for one particular approach and not for another, and how we can get people to work together. And I'm also interested to discuss, but we might touch on that later, so I'll stop here, in respect of what we can learn, not alone from each other within Europe, within the European context, but further afield from other regions. Thanks very much, Mike.
Thanks, Siobhán. And just maybe before I introduce the next speaker, just a reminder to the audience, for those people who've joined late, that this is the first of a series of webinars, that are looking at particular regions around the world. And there will be future webinars on other regions, but here we're focusing on Europe. And I think that final question there you mentioned about what can we learn between regions is a really important one. Hopefully we'll come back to it. But now I'd like to introduce our third speaker. Maria, would you like to go ahead?
Yes, thank you. Allow me to start by congratulating the organizers and also to greeting my colleagues in this panel and all participants. And of course, also to thanks for the kind invitation to talk about lessons learned from COVID. I would like to start by referring to a couple of introductory remarks. The first one, that COVID-19 was not only a health crisis, but also economic and social one. So the cost was really too high for us not to learn the lessons from this event. And in fact, we know that the question today is not if it will happen again, but when, where, how, because it will happen. Another remark that I would really like to do is that this slogan, this jargon of learning lessons, sometimes is very much it's often referred to, but did we in fact learn lessons before? I remember the Canadian Ross Upser that last year did a conference referring to the SARS outbreak, the swine and the chicken flu, Ebola, MERS, Zika. At the end, he said the most important lesson we must learn from these outbreaks regards our inability to learn lessons from past outbreaks. And this is something that we have most definitely to change. In fact, if we look to the European region, we can see that there was some initiatives before. I will not read, I will not take time to read what you can easily see, but there was indeed some important steps. But in 2009, after the influenza A outbreak, the evaluation that was did was that everything was a kind of under planning. So there was steps from 97 to 2009, not enough. And from 2009 until COVID-19, well, I think that it's really important to learn lessons and looking back, as it was shown already, and also looking forward, with which I will do now very briefly. First of all, looking back, and here I try to find kind of some issues, some topics that would be more specific to the European region. A first one focusing on health resources. There was a shortage of personal protective equipment, such as gloves, medical masks, respirators, goggles. And this was a consequence of the recollocation of economic activities to other countries. So Europe had to start by engaging in very competitive and sometimes complex process for the purchases of very basic goods. And this was really the beginning of the pandemic. Focusing on organization of health systems. Health systems need indeed to be prepared. They were not. The coordination between different sectors, the public sectors, public and private, hospitals and social sector, educational institutions, there was no coordination between these institutions. Therefore, a rapid response to mitigate the effects of the pandemic were not in place. Also, one thing that was already referred to, routine patients and chronic patients were not attended because they did not fit into the emergency situation where we were. A third point, and I think this is perhaps the most particular to Europe. There are, as far as I think, there are two European characteristics that may have created unique or at least less common situation in this region during the pandemic. The first concerns the high rate of elderly people, which has led their increased vulnerability and also to a very high number of deaths. Elderly were left to die, sometimes without access to ventilators, and sometimes just abandoned in nursing homes. Ethical criteria must be established for prioritizing access to healthcare goods. The second concerns strict respect for human rights, many of which have been suspended for the sake of public health. It is important to establish proportionate models of balance between individual rights and social duties. Fourth and last point here on looking back, it's about communication. Communication builds trust. Trust builds compliance, and compliance builds protection at individual and community levels. And here, for instance, the ethical advice should be indeed included, which I don't think it was along the pandemic. And well, let's move forward. And here I would like to stress that indeed the European region recovered from the pandemic. And now the key priorities has to focus on prevention, preparedness, response, and resilience. That is the most important thing. I selected a few points. I will not go into detail, just point it out here. A first one, accelerating scientific, multi and cross-disciplinary and translational research. Part of it was already referred to. And this is the one first key point. A second one, investing in prevention, monitoring, computational modeling for predicting the spread of infections. And these monitoring efforts should be comprehensive, evidence-based, rapidly shared, well coordinated across EU. Otherwise, we will not have a strategic decision and response in a concrete situation. A third one, well, enhancing coordination, and this should also include a toolbox of strategies, so we can intervene in a flexible and dynamic way to strengthen synergies between European institutions as well as European institution member states, and also at the international level. All these strategies should be based in scientific evidence and guided by fundamental values, fundamental rights, to take into consideration values such as equity. A fourth point, strengthening the national health systems and improving resilience. We need effective, accessible, resilient health systems, what requires stable funding, sound risk adjustment methods, good governance, fast information flows, health work of adequate capacity when the expertise also, in order to improve this resilience. A fifth point has to do with the developing communication strategies. And here we have to stress the importance of transparency, openness. They are crucial. Also clarity on what is known, what is not known, what cannot be known. Six, encouraging efforts in community involvement. Organization and support for civil society, they have a role to play, and it's very important to also include them in the decision-making process. and also protecting fundamental rights. This has been mentioned here. We have to bear in mind that, for instance, the principle of necessity as well as the principle of proportionality is important to decide what kind of restrictions, if any, should be put to citizens. And this should be provisional, and there should be also a compensation for those that are most affected. A last point that I'm presenting here is also to start sharing another approach to public health issues. One health approach to understand the interdependence between humans, animals, and the environment. We should have this holistic approach if we want to tackle the problems of a new public health emergency. And I leave you here what one sentence that I believe is quite inspiring from the European Group on Ethics that puts values in the center of all the interpretation of our situation, and also on the decision-making process. How should we act? Values are an important topic to take into consideration. Thank you so much.
Thank you very much, Maria, and thank you to all the speakers today. So we just as a reminder that if you would like to, or if you'd like me to ask a question to our speakers, one of them or all of them, please do type your question under the Q&A button. So don't put it in the chat because it will get lost there. But you'll see there's a different button at Q&A at the bottom. And as I mentioned at the beginning, the purpose of this webinar is to focus on the experience of Europe in relation to COVID-19, and also hopefully we'll go on to talk about the implications for elsewhere as well. So I guess just to start off, would be one of the things you mentioned there, Maria, was about the importance of coordination. And I do think that, you know, there was a degree at least of coordination across Europe in relation to ethics. So there were conversations between national ethics committees and so on. And I just wonder whether anyone might want to say something about the extent to which that was valuable, and maybe how problems were dealt with. So I think you can develop problems, for example, about the fact that different countries and different regions of Europe might have had different views about what the appropriate thing to do was. So anyone want to comment on that, the role of the importance of coordination and what its limitations were?
Mike, I might jump in there if that's okay.
Yeah, sure. Go ahead.
Yeah, so I think coordination is crucial, but I think one has to be realistic about its limits. So I think what was really useful, certainly in the Council of Europe, was that you were able to reach out to others and find out, you know, if they had a particular problematic issue, for example, access to ICUs, or were people actually going to use COVID passes once vaccination was introduced, etc. It was fantastic to be able to reach out to colleagues and to find out what the thinking was in relation to those issues. And it absolutely informed your own thinking, no doubt about it. Certain countries who might have been ahead of you in certain aspects could feed back what things had worked, what things hadn't worked. But I think it is important to talk about the limits of that as well, because there were several countries, even within the European region, who took quite divergent positions. So I think some countries, for example, like Ireland, had quite stringent measures in place in respect of movement, and people being able to, you know, the amount of distance people could go from their homes, the amount of mixing that was allowed. As Signe has said, we also had children not attending school for a period of time, workers at home. And it was interesting from the political perspective and indeed the public discussion. People were like, but hang on, people in Sweden are allowed to go to parties and, you know, move freely, and we're seeing pictures there and we're all locked up in our houses. How can this be possible? And to try and explain that not alone are there cultural differences between countries, there are also a number of structural differences, which means that different types of approaches need to be taken. So, for example, if you have multi-generational kind of living together in certain countries where you have a lot of intergenerational mixing, obviously that's much more problematic than you have a lot of single households. So I think context is important. So solutions are not directly transferable, even though we were all looking to each other's countries to see where the examples were. So it's really important to be informed by what other people are doing, but it's not always directly transferable.
Right, well, thank you.
If I may add some comments, I totally agree with what it was just said, and you mostly talked about coordination at the ethics level. And you are absolutely right. We need to see the context, so the solutions are not the same. If we talk only about coordination, and I would like to stress that also, we are in a very privileged situation in the European region, mostly those that are part of the member states that are part of the European Union. This is a privilege because coordination is it should be considered as granted. We should work in a coordinated way every time, every day of the year. So our starting point to fight a pandemic should be an advantage in relation to other regions. I think that we need to explore this much more. I think that during the pandemic, there was great advances at this level, and the European Commission did learn a lot. The reaction at the beginning of the pandemic and the reaction when the vaccines became available was totally different. So I think that at that level, we did learn something. Allow me to stress another point, that is the role of ethics and of ethics committees in the pandemic. And here, from my experience, not only in Portugal, but a little bit elsewhere also, I should say that they were not really much involved in the public policy decisions. I remember that in Portugal, and being the president, the chair of the National Ethics Committee, I was constantly saying in the media that we were not involved, that we had a saying, and we were always engaging in presenting solutions. But as a matter of fact, we were never part of the pluridisciplinary team of the government where the major decisions were taken. And the very last point that I think it should also be considered is that if we looked, and I studied all the reports and opinions in Europe about how to take care of patients and families during the pandemic, there was the majority of the national ethics councils did have an opinion on that. It was not followed, especially in relation to the treatment and the priority or not priority given to elderly. So the ethics opinions went in one direction and the political and medical decisions went in another one. This is something that we have to address.
And if I can, sorry, if I can add very shortly, I fully agree that Europe was privileged in many senses. And we had very good exchange of information, and we even had examples of cross-border support when there was need for help in neighboring countries. But on the other hand, it's clear that we have to make decisions in each country separately, and there are different capacities of healthcare systems. There are sometimes different values or different interpretations of values, and especially if we involve public in the decision making, the results might be at least slightly different in different countries. Yeah.
I wanted to pick up on the point about the role of ethics advice in this in relation to policies. You mentioned Maria, and it's others, the others of you gestured towards too. So I guess one question is, we're all keen, given we're ethicists, we're all keen to integrate as much as possible ethics into policy making, and we've recognized the fact that many of the crucial decisions made during the pandemic were value judgments, essentially. So how do we do this? So how do we integrate ethics into policy whilst not giving the impression that we're giving political advice, as it were, on making political decisions, because that's certainly in my own role in the UK, I would quite often come up against this thing. Well, yeah, you know, when I was trying to give ethics advice, I'd be presented as trying to give political advice. So, and how do we integrate ethics in a way that the political system will accept and live with, I suppose, is the question. I mean, Siobhán, I don't know, maybe start with you if you.
Yeah, thanks, Mike. I think it's really interesting. I think there's an overarching comment I would make first, and then to address your question specifically. There is always going to be a tension, and I think that was very clear for many countries in the European region, where there was ethics advice or indeed even science advice, something that was considered to be evidence, much harder in that sense, right? That it was, the question then became, that advice was being given, i.e. you need to lock down if you don't want to have so many deaths. And we've done the modeling and this is what it shows, right? And the political system didn't always necessarily take that advice. And I think what's important is that relationship, and Maria and Signe both alluded to it, the relationship between the advisory arms and actually the political system. Because what I would say is that ethics, and indeed even the evidence, the science, are two inputs into a much broader landscape. So if you're on the political end, you have to take into account, do you have the money to do it? What are going to be the unintended consequences of one action on some other part of the system, et cetera, et cetera. So there's all of that. And in the end, it's the political system who are democratically elected. So it's about being really clear about the various roles of all of the parties, and that the public is clear about the various roles of all the parties. In respect specifically to ethics, I think it's really, the one thing I would say there is, it's very difficult, as Maria has talked about, to bring that to the fore and to ensure that ethics is involved. One thing I would say is, one thing I found really interesting is that not everybody was entirely transparent or clear about the ethical approach that they were actually taking. So, you know, you can't talk about a global ethics in that respect. I think it was important that people would say, look, we're actually using a utilitarian lens. So from that flows the following, right? But I was very surprised to see that people were not very transparent about the ethical framework or the ethical lens that they were actually bringing to something. So there's an obligation, I think, then amongst us as an ethics community also to be clearer around that, because as Signe has pointed out, that can be contested. So we all know that, you know, you can come to a number of different conclusions by putting an ethical framework in place, but we need to at least be clear about how we've gone about designing the framework and how we're applying it.
Brilliant. So my next question is going to be about that, which I think is great, very timely. But does Signe or Maria, do you have anything you want to say first about the role of relationship between ethics and policy making? Signe.
I think one of the main functions to add for ethicists in this process is asking the important questions, because we cannot always give the one and only answer, but we can ask and we can point towards ethical values, towards principles, and towards human rights. And I think the worst situation would be if the decisions would be made without asking important ethical questions, without this ethical compass.
Okay. Let me ask the question about values then, because you all raised that. So, you know, as you've all just said, making a value judgments is a core element of pandemic preparedness, response, etc. So. And you also said, Maria, I think that, you know, we were a bit unprepared. We're unprepared for that. And it's difficult to make value, you know, come to an agreement about what values matter in the midst of a pandemic. So it's always going to be pressing. So I guess the obvious question there is, to what extent can we as ethicists, presumably with others too, work on developing some agreement about values kind of in the period between pandemics as part of pandemic preparedness? You know, is there work that could be done? and how one might go about that. Well, obviously we're talking about the European, presumably, and also the national context here. I don't know whether, Maria, you want to start, and it'd be good to get everyone's views on that.
Well, I think that this kind of work has to begin right now or yesterday. I mean, we cannot pretend to be a silent voice during peaceful years without any kind of emergency, and then to pop up during an emergency situation. So I think that the national ethics councils or committees do have a very important role every day of the year. So we have to make ourselves useful, and we can do that if along the year, year after year, we focus in important issues that are not only important at the theoretical point of that are really important for civil society and also therefore for politicians. So first of all, we have to choose what kind of issues do we really consider that are important to be discussed and can make a difference for those that have to take a decision on those points. Secondly, we need to be pragmatic. We need to offer a specific way to go. Siobhán was referring to refer to our lenses. I would say in a different way to justify our position. I would not choose to present myself as a utilitarian or any other ethics perspective to politicians or to the civil society. Of course, I can do that at the theoretical level. But what I really think that is important is to justify in a reasonable way what are the advantages, what are the benefits of taking some values into consideration and not others. So not to go too in deep in the theoretical realm. That's what I believe that it's important. And well, again, I think that it is important to to make ourselves present in society every day. I remember, if you allow me to speak just a couple of seconds more, during the pandemic, there was public policy launch on children vaccination. And it was really, in some points, kind of messy. So the National Ethics Council did not wait for the politicians to listen to us because they were not paying attention to us, but we decided to make very fast an opinion with a few recommendations. We did that in less than a week, and we launched it in the media. And immediately after, the politicians and members of the government reached us to say that was really important, and they were starting to think about our advice in further decisions. So we have to be also more proactive and choose carefully what we are going to say. Well, what are the topics that we should focus on.
Thank you very much. Signe, so this is a question about the extent to which we should be working on developing our ideas about value priorities, you know, in between pandemics or in advance as part of preparation. Do you have any thoughts about that?
Yes, I think it's in big extent also question about public literacy, about public ethics literacy, because I have this impression that in many cases, or at least in some cases, when politicians, ethicists, medical professionals discussed ethical issues, public lacked maybe some, at least in my country, they lacked this literacy about ethical principles, or how we perceive ethics, or how we define equity, for example, etc., etc. So maybe we should pay more attention not only to health literacy in context of pandemics, but also to ethics literacy.
That's a great point.
Yeah,
Siobhán.
sorry, Mike, just to follow up on that, I couldn't agree with Signe more, because what I found interesting was the entire country after about 12 months were all almost epidemiologists. So everybody could tell you about our numbers. It was incredible. It became, normal discussions between people who knew nothing about epidemiology before the pandemic. And yet the things that people instinctively might have had a view on about, for example, whether we should, or how constricted our liberty should be, how we should treat older members of the population, etc. That really didn't feature in the discussions. And we didn't have the language actually to have those discussions. So I think that's certainly something at the population level. And to Maria's point, it's not that I was suggesting we should all be very clear on the theoretical level about we should as ethicists, but we should be able to explain that in a way to our political system and indeed to the public, exactly as Maria said, about why one particular course of action was being pursued and not another. And I would say something we experienced is you can have very nice ethical frameworks, but unless there's capacity on the ground to actually understand how one translates that ethical framework, and I see somebody in the chat has made that, in the Q&A has made that point, it's about building capacity. So I think we need to build capacity in our system that people understand if there is an ethical framework, this is how in this particular context, at my hospital or in my care home, etc., I can weigh all of these various values. And I think there's a lot of work to be done in that respect.
Fantastic, thank you very much. These hours go so fast. I can't believe we're already at the end of it. I will make a little bit of an effort at the end to try and pick up on a couple of the points from the Q&A. But one thing I do think it's really important we ask ourselves, given that this is an initiative in trying to sort of see what could be learned between regions as well as understand regions in more depth, is to ask you, whether you think there are things that were done elsewhere insofar as you're aware of them. I mean, generally, but particularly from an ethics perspective, I suppose, things that were done elsewhere in the world that we in Europe could learn from, that Europe could benefit from taking a lesson from. So yeah, maybe if any of you have any thoughts about what you would highlight there. Anyone want me to jump? Should I pick on you? Signe, you go first. I just pick you in order.
It's a hard question because we are so immersed in our realities that maybe the lesson is to learn from other countries. Maybe our silence shows that we haven't done it yet as much as we can. And I'm sure that there are lessons to learn, but I think I would refrain from particular examples.
Okay.
Mike, can I jump in there? Because I have one that I've been reflecting on quite a lot, which is that I suppose to a certain extent, and I don't want to be generalized, but to a certain extent in Europe, we tend to take a very individual notion sort of autonomy. So so this was a very different situation because we had a public health crisis and we had to think in more public health terms. But one thing that I have thought a lot about is that in trying to preserve autonomy, we thought about it very much in those kind of individual terms. And when I reflect back, the kind of restrictions that we put in place were to protect people, to minimize mortality and morbidity. But it had very negative effects, as we've already talked about, in terms of mental health, in terms of older people perhaps dying alone, in terms of the way we buried people, the way we grieved people. There were very few people allowed. At one point, it was like 5 members of a family. And in Ireland, at least, we tend to do death in a big way. We have a lot of funerals. We have a lot of people who, large numbers of people attend. And so that was a very traumatic experience, actually, for many people in this country. And what I've reflected on is that, In fact, I don't understand why I didn't do it, but it talks about how siloed we can be. There's great experience in other parts of the world, for example, in Africa, where they take a more communitarian approach. I know that lessons were learned around Ebola in respect of how to bury people, how to deal with that whole issue of how to grieve, etc. And yet we didn't think about looking to our colleagues in that part of the world to say, how do we deal with this difficult? Because we know that funerals were a big transmission area, but we needed to be able to respect people's, like, one of the most fundamental moments in their life where they lose a loved one. So I think we need to, I think Europe can be very cosseted in that respect and not look beyond the region to actually learn those lessons. So a more communitarian lens, I think, about how to balance, that kind of protection on the one hand, but understanding relational autonomy on the other. So that would be my lesson.
And so we've got coming right up to time, but one thing I did want to pick at, several people in the chat have obviously related Europe to the rest of the world in ways that are really interesting, and we'll try and answer all these questions at least in word, in typing, if we can't answer them in verbally. But I want to pick up on your point, Signe, in your presentation, which was about this COVID-19 being a test, a key test of global solidarity for Europe. The extent to which Europe has responsibilities to the rest of the world. Several people in the chat have raised questions about global justice being a key component here. So, for obvious reasons, we've been looking internally at Europe in this webinar, but I would just wonder if you could say a little bit more about that, because that does seem to be a key challenge that Europe kind of met in some ways and not in others.
We all know that there were attempts to secure global justice, and in distribution of vaccines and in other fields, but we tried. But we cannot say that it was a great success. And I think it was just a starting point. And to prepare for future pandemics, we have to find out how to practice global justice much better, because it wasn't as good as it could be in COVID-19 case.
Thanks. So we've got like 1 minute. Does Maria or Siobhán, you want to add anything before I wrap up?
I think there's much to be done at the level of global justice, but I would not be so critic towards Europe. Indeed, I think that it was the European Union was the most solidary when comparing to other, such as the United States. For instance, the United States started to offer vaccines only when their needs were totally fulfilled, and that did not happen in Europe. Also, it's not only, and we have to realize it's not only a question of giving vaccines. The African continent had to struggle with many different kinds of vaccines that require different ways to handling. Also, only to offer vaccines does not fit the states with healthcare, with the health systems to distribute the vaccines. And still another point, there was cultural issues. And I know Africa quite well, and some of the communities would say we have other health needs. We need also education. We have needs at the basic nurturing issues. And you are giving us vaccines that we don't need because this is a white disease. So there's a lot of variables that we have to take into consideration when we talk about global justice. Of course, that is a main goal for all of us, to have a fairer and equitable world. That's absolutely right.
Great. Okay. Thank you very much. I think we should probably end here so that we roughly on time at least. I guess one thing to mention there in relation to those last points was, I think there was a webinar, can't remember when it was now, not that long ago, on the pandemic treaty and the discussions around that. So that might be worth, if people are interested in that topic, you could perhaps take a look at that one too. I'm sorry we weren't able to get to all of the questions or comments that were in the chat and the Q&A. Many questions that were really important, many relating to global justice, some relating to specific questions, such as questions relating to equity, issues relating to confidentiality and the management of information and so on. So there are lots of questions there, which we really appreciate you raising for us. I'm sorry we couldn't get to them all, but I'd like to end by thanking our 3 speakers. Delighted to see you all online and to hear you speaking, and to let you all know that the webinar will be, I don't know when exactly, but reasonably soon it will be available on the Epidemic Ethics website. So thank you very much. Thank you all.